So, serious topic today. This one is on medical PTSD. If you look back at some of my previous videos, specifically the one on dealing with depression during isolation, I talk about a period of depression that I was going through. When I actually think back to this time, and I'm still going through it now, but when I think back to when I was filming that video, I didn't really realize that what I was actually going through wasn't just depression and anxiety, it was actually medical PTSD. I wanted to make this an overview of what medical PTSD is so that you can identify whether this is something that's been happening to you and actually seek some help for it. It's something that can not only affect your life in a really huge way, but something that can affect your ability to accept medical treatment, which is pretty serious. First, I'm going to go into what exactly medical PTSD is, and then I'm going to share my own personal experience with it. Before I made this video, I really sat down to think about how this was affecting my life. And first of all, figuring out that it was medical PTSD, but how it's affected my life. And I also spoke to a lot of other people with both chronic illness and who have suffered various types of medical trauma to understand how they perceive what's happening with them and to understand their experience of medical PTSD. So some of the symptoms can include being easily startled, feeling tense or on edge, having difficulty sleeping, having angry outbursts, hyperventilating, panic attacks, general anxiety, flashbacks, frightening thoughts, nightmares, distrust of other people and medical professionals, a warped sense of perception of medical professionals and maybe of the world, fear of your own body and your own symptoms and pain, health anxiety, like absorbed in research, hypochondria, hyperfixation on symptoms and things like markings on your body, feeling like you've been so mistreated that you decide to just wait it out during potentially life-threatening situations, not having extreme symptoms being checked, like extreme pain or fever, avoiding medical appointments in general or despite new or worsening symptoms, keeping new medical information from your doctor out of fear of how you will be treated, triggered by certain sounds, smells, tastes, and touch. PTSD is usually experienced for at least 1 month or more in order to be diagnosed, and it doesn't mean that you have to have all of the symptoms in order to be diagnosed. Some people develop medical PTSD for a number of reasons, so I've compiled a list of possible reasons why this particular type of PTSD might occur. Some people may have this from having a serious or prolonged illness, having a hospital stay, having a near-death experience, going into a coma or almost going into a coma, almost dying during a procedure, being awake during an invasive procedure, especially things like pelvic exams, being injured from a procedure, treatment, or drug, awakening during surgery, medical neglect, especially when consistent and from multiple doctors, having consistent painful procedures, having conditions that are unstable and volatile in any way, like anaphylaxis or fainting spells, being bullied, verbally or sexually abused by doctors, EMT, or really any kind of medical or alternative practitioner, developing complications from drugs, surgeries, or treatments. PTSD is a really difficult thing to overcome, and it's something that you really should have a strong support system for. And for me, I don't have a strong support system, so it has been really, really, really difficult to get through. At the time that I started to develop it, I was working at a company that was a very reputable company, and I was really excited about the job. It was a contract position, and it was kind of like my comeback after my first pancreatic attack, where I had taken about 6 months off in between working and not working. And I thought that I was better. I thought that things were going well. And then all of a sudden I had another pancreatic attack again. And that was it. They fired me. And I only had a few weeks left of the contract. And I had actually asked if I could work from home because I had the laptop with me. Somebody had put it in my bag when I had to leave and go to the ER the day that I got really sick. So I had my laptop with me, and they had a work from home policy. They just refused to let me work from home for the last little while, which was it was just especially devastating because I was so close to finishing that contract, and I had already put in like 4 really good solid months of really, really hard work. By this point, I realized that I was having pancreatic insufficiency because of the first pancreatic attack that was never actually addressed by anybody. That like I was going and trying to get help during the first attack, like desperately trying to get help. I went to like 6 different ERs, and I went a total of something like 17 to 20 times. Like I was counting at the time. This was during the first pancreatic attack, and nobody would help me, like no one. And I didn't go right at the 24-hour mark. So you're supposed to get your blood work done 24 hours to 72 hours into your first acute attack, because your levels will elevate. And after your first acute attack, you may not, if you have pancreatic damage, the levels may not rise anymore. So basically that's what happened. Like I went in a little too late. I was traveling for work when I had my first attack. And then by the time I got home to get this treated, because I wasn't getting any better, I was just getting sicker, then my levels weren't rising when they checked anything, except that I definitely wasn't absorbing any of my food, and I was losing a ton of weight. I was like super, super sick. I was so sick, I was like crawling to the bathroom. And I think I mentioned this in my other video. And my weight was just like plummeting. Like I was down to like 95 pounds. I was in so much pain. I was so much pain. Oh my God. It was unbearable and unbelievable how sick I was. And I was so desperate for help. And I got turned away at every corner. Like my GP at the time did not care. Like I remember going in one time with like, it was like during the attack, and I was so sick that I had to spend most of my appointment in the washroom. And I told her that when I actually went into the appointment, and she did not care. Like she just didn't care. She was just like, well, our time's up, like halfway through. And I'm like, no, you don't understand. Like I'm really, really sick. Like we need to do something. And by that point, I'd already been coming to her about this issue a number of times. Our relationship was already damaged. So this further damaged our relationship. And I was really quickly learning to not trust doctors, basically. And, you know, I would go to the ER and try to get help during this time as well, because I mean, it was a really like acute pain and acute sickness, and I wasn't getting any help from my GP. So, you know, I really had nowhere else to go. So I was going to the ER a lot, and it wasn't doing anything. Like they would just turn me away. They would just say, I don't know. I don't see anything on your blood work or your scans or anything. So, you know, at the end of the day, finally, they were just like, you know what? I think it's psychiatric. I think you just need antidepressants. And I mean, I'm sure that a lot of you have this story of people just telling you that it's all in your head, you know, and that there's nothing really going on, or that maybe insinuating you're doing it to yourself. It's just impossible to believe that somebody in an entire system that's supposed to be helping you is not helping you. Like they're not even trying to figure out the reasoning behind why you're having these symptoms. And I mean, I was having other symptoms like night sweats and really severe nausea. Like my mouth would just be salivating from like the nausea. I don't ever throw up for some reason. I don't know why, but the nausea was really, really severe. And the night sweats, like I was sweating, like soaking my sheets every night. And I was having fevers and chills, and yet like they would just say, I don't know what's going on, you know? And then not to mention like all of the food that I was having diarrhea constantly. It was just like every bit of food was going right through me. It would feel so painful to eat that I just didn't want to eat. And that was part of the weight loss too, was kind of the diarrhea and then the pain. And then on top of that, I would get dehydrated because of the diarrhea. So I was always going in totally weak and confused, and finding it harder and harder over time to advocate for myself because I was getting so sick. And because of this huge neglect, I just couldn't feel like it was a safe place for me to go. Like the hospital wasn't a safe place for me to go, and telling my story to these doctors wasn't safe for me. It wasn't doing anything. Pancreatic attacks can kill you. Like it's not something to just mess around with. They can cause organ failure, heart attacks, sepsis, kidney infections, organ infections. Like it's a really serious condition. I mean, you can starve to death. Like I mean, if it's really left untreated, it's just like unbelievable that no one helped me. And I would even go in saying, I think this is what it is. And then I would get all of these people throwing myths at me, like all of these doctors, throwing myths at me. Because I would go and look online at like the National Pancreatic Associations and like figure out like, oh, wow, okay, this is something that can be missed on the blood work, and then I would go into the ER and they would stress this blood work, and I realized I need a pancreatic specialist like now, like yesterday. By the time I was able to actually see a pancreatic specialist, it was like, I don't know, maybe 9-10 months into this whole thing. It was about a year. It was at least a year, maybe even a year and a half. And by this point, like, I absorbed like nothing I was eating. Like, I could just eat and no weight would go on me. And it was really, really scary. I was asking many different doctors if they could just give me a PERT, which is a pancreatic enzyme replacement therapy. That's what it stands for. And I would just get denied, even though there was almost no side effects to them. And even though it was pretty obvious that that's what was going on. Like there's only a few reasons that you would have oil in your stool. And I didn't have any of the other ones. I'd already been tested for the other things that could have caused it. So there really was no other reason why I would have had this, especially on top of having exact symptoms of acute and then now chronic pancreatitis. Yeah, I was denied the PERTs until I finally got in to see a pancreatic specialist, which was a lot of legwork on my end. It was a huge amount of legwork and begging other specialists to send me to another specialist who would send me to another specialist. So the fact that I had to fight so hard for my life and still wasn't really getting the right treatment is pretty big. And I still don't have the official diagnosis. I know that's what's going on. I can see that the doctors here don't understand chronic pancreatitis. It's very rare. And I have spoken to doctors in the States now who are pretty sure that that's what's happening with me. Even now, I'm struggling to get proper treatment for this. The worst part about all of this is that this could have been prevented, in my opinion. Like if you have the pancreatic attack and it's treated promptly, like I said, you can make a full recovery most of the time. So I think it's like 80 to 90% of people make a full recovery if they just get some digestive rest in hospital, they just get some fluid. And I was asking for this. Like I was actually asking for that fluid and that digestive rest. Like, just give me a few days. Just give me like 3 days in the hospital where I don't have to eat. I don't have to drink. Nothing has to go in my stomach. And it can just like calm down. No, I was totally denied. Once you have that pancreatic damage, you can never go back. Like it is now going to become a disease where the pancreas will continue to become fibrotic and it will just calcify basically, and it will fail. And how that works is the digestive enzymes that your pancreas creates, which digests all of your food for you, it loses the ability to create all the enzymes, hence why you need the PERTs. And then eventually type 3C diabetes kicks in, which is like type 1 rather than type 2, where you just can't produce insulin rather than an insulin resistance. So the levels of your blood sugar can swing up and down a lot more dangerously and drastically and without warning. So all of this led to me sitting on the couch for 8 months or so, totally paralyzed in fear and grief and depression, to the point where the only thing that brought me comfort was planning my funeral. And I did. I planned like every detail. I found myself a funeral home, and I did like laid out all the plans. I put down deposits. And I like, that was the only thing that I could really feel like I had any sort of sense of control over. Like I said, I don't have a lot of support. So I basically spent that time alone. I had my brother come over here and there sometimes, but other than that, it was a really, really dark period. I'm still kind of crawling my way out of that. This was really like the nail in the coffin in terms of my relationship with my GP, because she was already neglecting me for years before this, and I was already becoming pretty messed up over like that itself. So when this happened, it just like, I don't know, just made me kind of like implode in general, and our relationship was like totally destroyed by that point, and I really didn't have anybody to handle my care. A few months later, I found a GP. So far, he's been really good. I've had him for about a year. Sometimes he's stumped on how to help because his hands are tied in a lot of ways too. And because it's been really difficult trying to get a diagnosis on this. And it's very difficult to get the diagnosis on chronic pancreatitis because it can take 5 to 10 years for it to show up on scans. So it's starting to show a little bit on some of my scans and then not on others. So I don't have the technical diagnosis yet, but the pancreatic enzymes help tremendously. And I've been able to put on some weight as long as like I don't have more attacks. Like I have had other attacks since. So when that's happened, like then I drop the weight again. And it's just like this cycle of never knowing like when you're going to have this really severe pain and sickness and be like totally taken down again, and not be able to like prop yourself back up, wondering if this thing is going to kill you this time and in what way it's going to kill you. And I did have another attack in May that landed me in the hospital for a couple weeks, which I was actually really lucky to get that hospital stay because I was still under investigation for this. And because of COVID, there wasn't very many people in the hospital. So they kind of said, okay, like come in, I guess. And that was under the pancreatic doctor. But he's since discharged me. So if something happens again, I don't have anybody to go to. Like there's nobody who can give me the privilege of going like to the hospital. But during that time in the hospital, I realized just, wow, like this is so serious, you know? And I was starving too, because like I hadn't eaten for 2 weeks during the time I was in the hospital. I was just hooked up to sugar and salt water, not even TPN, which is total parental nutrition, which is when they put a line at central line that goes to your heart and they put the nutrition through there in a liquid form. It's not a feeding tube, it's separate, but I didn't have that. I actually was just on sugar and salt water through my veins. Having those 2 weeks made a huge difference in terms of like the length of time that I had the attack. But I know I'm never going to have that again. So that's like another thing that I have to wrap my head around, you know, it's just like, oh my God, no one's going to help me next time. I'm very afraid and distrustful of doctors now and of the entire medical system. I'm becoming really afraid to go out of the house. I'm becoming afraid to take medications, to try different procedures. I just, like, my whole life has changed. Like before, I wasn't like this before. You know, I had years of chronic illness, but I was never afraid like this. I'm having a really hard time coping. I don't trust doctors and I feel pretty afraid of them, to be honest, like of any medical professionals at this point. I don't trust that they would want to save me if something happened, like no matter what it is. Like even if I were to go into an anaphylactic reaction, like I don't trust that they would actually save me or want to save me. I have like absolutely no faith in our medical system or in people anymore. I think when I had my first pancreatic attack, I'm pretty sure I had a heart attack, like a minor heart attack. Like I had all the symptoms and I mean, it was really intense. And I spent 3 days with these like residual effects of like this really intense episode. But I never got it checked because at the time, that's when I was going to the ER often to try to get this pancreatic thing sorted out. And I had gone so many times that like no one helped me. So I didn't go when I felt like I was actually having symptoms of a heart attack. Like it was full like pain into the jaw, down my arm. Like it was extreme exhaustion. It was literally a crushing feeling in my chest. Like somebody was taking my heart and like squeezing it as hard as they could. Like it was really terrifying. I had trouble breathing. Like it was really, really bad. And I didn't go. I'm telling all you guys this because I suffered alone and it was a living hell and I had no idea what the hell was going on with me. And I don't think anyone should go through that, including you. If this is something that you feel you have, I really encourage you to reach out to people, to just reach out to anybody that you can. Feel free to message me. You can find me on Instagram at Show You Stripes. I'll put it down below. Also, just reach out to your friends and your family. I mean, like I said, I don't really have a big support system or much of any really, but most people do. And I really think you should reach out as much as you can to anyone you can about it. Talk to your doctors about it if you do feel comfortable. Like if there's that one doctor that you feel comfortable with. Because for me, what I did was when I got the new GP, it took me a long time. It took me about like a year of actually dealing with him. But after about a year, I actually told him, like, I think this is what's been going on. I've had a lot of bad experiences and I feel like I find it hard to trust my specialists. And I want you to know that I do have faith that, you know, you're going to help me in the ways that you feel you can. And I want to let you know that I'm just struggling with this and I want to work on it with you. And I think like that conversation alone really helped our relationship to stay strong. And I think it's something that's definitely worth doing if you trust your GP. I would say it's worth doing even if you don't trust your GP. Like if you feel like after that conversation didn't go well, then maybe you need a new one. All in all, my point is like, don't go through this alone. So in closing, I want you to be safe. I want you to be well. I want you to know you're not alone. And I want you to be kind to yourself. I'll see you next time.